Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're going to be looking at the topic of child development and mental health through a bit of a different lens. We're going to explore how insights from older adolescents and adults in both acute inpatient psychiatric settings and the prison system can help us understand what's most important for supporting kids who are struggling. The lived experiences and stories of people whom our systems have failed can teach us a lot about what we should be thinking about and doing instead. I've invited my colleague, Tara Bixby, on the show to discuss this with us based on her career of supporting people with mental health challenges in some of the most difficult settings a therapist can work in. Let me tell you a bit about her. She's an anxiety coach, licensed therapist, and everyday girl on a mission to change the mental health narrative. After years of struggling alone in silence, Tara broke free from the beliefs and behaviors that were keeping her stuck. Now she helps other women heal their anxiety, regulate their nervous systems, and find freedom from their symptoms through one-on-one coaching. She's also the host of the Courageously You podcast, where she has casual yet introspective conversations with guests covering topics from mental health, hormonal health, body image, holistic wellness, trauma, substance abuse, and much more. Tara, welcome to the show. Thanks for spending time with us today.
Yes, thanks for having me. I'm so excited.
You and I had the opportunity to have a really great conversation for your show a couple weeks ago, and I was excited to have you on this show to really just give people a different perspective based on your work experience with some really unique populations. And it's a perspective that I think, most people aren't really aware of unless they do work with people in those systems. But, as I mentioned in the intro, I think it's kind of a way of, looking at people who the system has failed and then saying what could have, should have, needed to happen there to better support these people. So I think it's just such an interesting perspective. I'd actually love to start by having you share how you got into the field of mental health in the first place, because we all have a story around that. So what's yours?
Yeah, it's so funny because I get asked this a lot. And honestly, it's not like a cool story. Like I was just somebody who I went into cosmetology. I used to do hair, and my clients just really opened up to me. And I remember one time a client told me she was raped, and I'm like, ooh, like that's really heavy. Like, I don't even know what to do with this. And so that's kind of what got me into psychology. And so then I went back to school for psychology, and then I moved to California for a boy, and I got into 911 dispatching, and I started to hear crisis stories, and I would have people calling in who were suicidal. And that just kind of furthered that interest of working with people. And then when I moved back to Idaho, I was still finishing up my undergrad in psych, no clue what I wanted to do with it. And one of my friends I was asking her, I was like, well, what are you going to do with your degree? And she's like, well, I'm going to go get my master's in counseling. And I'm like, cool, sounds fun. I'll do it too. So like no future planning. I was just like, that's a cool idea. I'll do it. And then when I graduated, somebody sent me a message and was like, hey, the prisons are hiring for a psych tech. You should apply for it. And so I was like, okay, well, like I'm one of those people. It's like, okay, cool, I'll do that. And so I went and did it. And it changed my life. Like nobody thought I was going to be able to do it. They were like, dude, you can't hack the prisons. You're too nice. You're too sensitive. And it changed my life. And so I did, the day I started grad school was the day I started there as a psych tech. And I worked with civil commitments in an acute mental health unit inside a maximum security prison. And I did that for 2.5 years. And then when I graduated, naturally, I was like, well, I want to be a clinician here. So that's kind of what got me there. It's no cool story other than I kind of feel it's my purpose, and doors were presented to me at the moments that they were supposed to, and I just sort of stepped through them.
I actually think that's a very cool story. I think it's a very unique story. I think many people have sort of boring or typical stories of, oh, well, I did my undergrad and then went to and got my graduate degree and then, became a therapist. And you're like, no, actually, I got to know people by having them in the chair at my salon, which is a form of counseling. I mean, honestly, Many people, I think women and men would say that that was sort of their first sort of dipping their toe in the water experience of, obviously that's not a therapeutic relationship, but it is a relationship that a lot of people use for talking about the realities and the struggles of what's going on in their life. So you used that experience then to springboard into learning more and then working with what we can all agree are some of the most difficult cases in one of the most difficult environments you can work in. I think it's a very cool story. And so I think you should reframe that when you tell it. Yeah. It's a very cool story, and kudos to you. And I think it's interesting because this idea, and we'll probably circle back to this in our conversation later, but this idea that you're too sensitive, attuned, kind, caring to make it in the prison system. Mm-hmm. Let's just put a pin in that, because I would argue that's one of the biggest problems with how our prison system works, is that there's this idea that you can't be kind and empathic and understanding and caring and make a difference there. So yeah, kudos to you for doing it. I think it's great. And as you have, you and I have talked about previously, it's really shaped a lot of how you understand what mental illness is, what the needs of these individuals actually are, and how much our systems fail people. So on that note, I'd actually like to dive in a little bit to what your work in these environments, because I know you've done both like acute inpatient psychiatric settings, as well as, the prison settings. What has that shown you about what we're getting right, but also what we're getting wrong about kids and adults and mental health?
I think for the biggest thing for me is, speaking just on the prisons, is I get so many people in who are now adults, they're incarcerated. And I always ask people, like, tell me your story. Like, what was going on? Or we have this thing called RDU. I joke, it's like the Ellis Island for the prisons. This is where they come in and we do all of the stuff we need to do for them to go to other prisons in Idaho. And I just always ask them, because one of the questions is, are you currently struggling with symptoms related to your trauma? And they all tell me no. And I'm like, really? Like, really? You're accessing meds right now through me, and you're wanting mental health services, but you're denying that your symptoms are related to past trauma. And so even just last week, I had a guy who told me no. And I said, hear me out. And I unpacked what he had already told me. And he told me that his dad used to lock him in a shed, and that he would be starved. And he would be like, my dad would literally pick me up from school just to physically abuse me. And I said, okay. And I told him about the nervous system and the role that it plays in it. He's currently incarcerated for domestic battery, which is not okay. However, he had that anger agitation. And so I wanted him to see the role that his trauma was playing in that anger and agitation. And he just started crying. And he's like, nobody has told me that. He's like, you answered a question for me that I've always wondered. And so people think these are just men who are incarcerated because they made poor choices. But the reality is, these are a lot of little kids where the system essentially failed them. Some of them had horrible homes. I know some of them, he was actually put in foster care for a little bit. And they're not addressing the mental health component of it. They're just treating the symptoms. They're just giving them diagnoses, and they're just medicating them without ever helping them get to the root of what's driving their behaviors. And then they grow up, some of them self-medicate, and then they end up incarcerated. And so I don't know if I'm answering your question, but pretty much I just feel like we're going wrong in that sense of, we could really stop our incarceration rates if we could redirect the resources and attention to the kiddos when they're young, to help them navigate what they're going through, so that as they get older, they have a better understanding of what they're engaging in.
Beautifully said. Yeah, we are missing the boat on connecting what happens in the lives of children with their key attachment relationships, their lived experience growing up, all of the various levels of trauma that happened to them. We're failing to address those in childhood. And then when they become adults, we're failing to address those underpinnings and just treating them like, you're violent because you're violent, or, you're a felon because you made poor choices, or, whatever, without recognizing that there's this whole history of things. And that, I think you said it so beautifully. This once was a child who did not get what they needed to develop a brain and a nervous system, and a way of processing and understanding the world that allows them to function well in adulthood. And it really begs the question of when do we stop seeing them as kids? Because I think one of the things that happens, there's a lot of empathy around kids. Oh, kids with trauma, we need to help them. But these kids grow up, and shouldn't we have as much empathy for them when it's the middle-aged or however old adult sitting across from you who is still that hurting child? But at some point we stop having empathy for that, right? And yet the nervous system underpinnings of that are still so very real for them.
Yeah, no, it's really hard because obviously I work with a population where it's sometimes tough. I work with sex offenders, and it's really hard for me to know what they did and still show up empathetically, or murderers. But I always just kind of have to step backwards and just be like, okay, when I look at this person, I'm looking at a younger version. What led to them engaging in those behaviors? What did they go through where their nervous system might have become dysregulated? Why were they self-medicating? And I just think we're so quick to diagnose, and we're so quick to over-medicate that, there's a time and place for all of that. But at the end of the day, what's from being a child to being incarcerated, what's happening between, and where are those resources, and how can we better support them? Because we do have a high incarceration rate. And the worst part about it is we have a high recidivism rate, which means that they come to prison, they get out, and they come back. And so obviously medicating them and just purely diagnosing them isn't addressing the problem, because they keep coming back.
Yeah, it's so true. And to be clear, neither of us is saying that the behaviors that these people engage in or the crimes that they commit are acceptable, are okay. Clearly they're not. This is about, though, unpacking this and understanding why these things are happening, getting to the root of that, not only so that we can help these individuals who are already adults and currently in the system, but I think it really does inform our understanding and practice of children and adolescents, where we are able to be more proactive about this, right?
Yeah. And I think it kind of came full circle for me when I was working. I temporarily left the prisons to go try inpatient psych with adolescents. And it came full circle for me because a reason I wanted to do it was because I'm like, okay, I would ask the guys that I worked with incarcerated. I said, what did you guys need that you didn't get? And they're like, we needed somebody to intervene when I was a kid. And so I was like, okay, I'm cool. I'm going to go work with kiddos in an inpatient psych hospital. And I realized that's kind of when they fall into the water. If you think of a river, that's where they're starting to fall in, is when they're in inpatient psych as a kid. And then I saw them all being over medicated. I don't feel like there was any trauma work. And it was a really tough pill for me to swallow, because I'm like, man, this is where it's starting. And then instead of trying to figure out how can we pull them out of the water, I want to go back to how can we keep them from falling into the water? I know last time me and you talked that I had a kiddo that was diagnosed with, I think it was RAD, and I couldn't get him into an inpatient or an outpatient psych facility after because of that diagnosis. And I'm like, this is where we fail these kids, is we give them a diagnosis and then nobody wants to work with them. And then they end up, not all of them, but then a large majority end up incarcerated as adults. So it was kind of a full circle moment where I was like, oh man, I can really see the bigger picture right now.
Yeah, it's such a unique perspective that most people don't have. But right, looking at that and going, here are kids who are still minors, who we have an opportunity to understand what's going on for them at a root level, not just address the symptoms, which is unfortunately what the mainstay of mental health care is, especially in acute care. They end up, at an inpatient facility or hospital for whatever the reason. And the approach is, let's get them diagnosed, let's get them medicated, and let's put them in a week or two of some group treatment and make sure that they have contact with a talk therapist, when they get out. And it's so clear that that does not even begin to address the issues because it's not getting to the root of why they're there in the first place. And, I've worked in inpatient settings too. And what always baffled me is all of the focus is on the minor child.
Yep.
Where is the focus on the adults in the life of the minor child? Because that is where we actually get the traction and make a difference. But no, it's all about this acute model of subdue the behaviors, sedate, send this kid right back into whatever environment without doing anything to change the system. And to your point, not only do they end up then potentially in a life of crime and things where the recidivism rates are high and they just keep, circling through that system. But we see that even in children, teens, and young adults in the inpatient and the acute care system, right? They become frequent flyers in that system and nobody stops and goes, wait a minute, what do we need to be doing here to prevent this kid from being back in this situation? Because clearly how we're handling it is not working.
Yeah, it's really tough because, you take these kids, it's the same with inpatient psych with adolescents and it is with incarcerated adults. You take them out of their environment and you're treating them as a sole person, and then you throw them back in the environment. And it's like throwing them back into a toxic sea. It's like, how do you expect them to be successful when they're back home if nothing changed in their environments? Their nervous system became accustomed to a different environment. And then it just goes down the whole nervous system trigger thing. But it's like, we have to address what's going on outside also that is presenting like this feeling of like they don't feel safe and their nervous system is responding. And so we did do some family work when I was inpatient, but we had some families that didn't want to engage. And it was very much so, my kid is the problem. And me being a therapist, and it's partly why I left, is like, I can't do this. Like, I'm not going to enable the parents and keep their kids here because they're unwilling to address their own their own role within this problem.
Which, for all of you listening, no matter what topic we cover on this show, we cover it through the lens of a systems framework and what as parents do we have, and other adults, other key adults in a child's life, do we have control over? How can we change ourselves? How do we need to be changing ourselves to support our children, which does not mean it's our fault that our kids are having issues. But Tara, to your point, like saying, well, my kid's here because there's something wrong with them and don't look at me and, try to get me to do anything. That represents a fundamental misunderstanding of why kids have these patterns of behavior and challenges in the first place. It's very much an issue of needing to look at parents and caregivers. And I would even extend it beyond that. As kids get older, and you've probably heard this certainly from talking to adults in the prison system, it's not just parents and caregivers, it's teachers and other people interfacing with them in school settings, in community settings, it's adults in their life, period.
Yeah, they need that opportunity to just regulate. Like they need that co-regulation. And there's so many parents, and it's not the fault of the parents. I think when parents can't regulate themselves, it's because they were never taught to regulate. And kiddos need a caregiver in their life that can help them co-regulate, that can help them regulate their own nervous systems. And I see that a lot, especially in incarceration, and I work with like the worst of the worst population. So I know when I talk about it, I don't want people to think like I'm generalizing it to everybody, but I notice with the population I work with is they lacked that caregiver role where they could co-regulate, and their nervous system just never felt safe. And so just even if going forward with kiddos, if we could have somebody in their life where they could regulate with, whether it be a teacher, whether it be a daycare provider, whether it be a doctor, just somebody that is that safe space for them where their nervous system can feel safe and it can kind of shut down and go back into ventral where it can discharge all that stored stress and it can minimize or prevent future mental health symptoms.
Let's dig into the nervous system piece a little more, because I know you're so passionate about this based on the work that you're doing. Why do you think, let's actually pan back even a little bit more. When we talk about regulating the nervous system. When we talk about helping, whether it's offenders in the prison system or kids in an acute inpatient setting, or just kids in general, or adults in general who are struggling, what are we talking about when we're talking about the nervous system and regulation and why that's so important?
So I kind of have married two theories together. So I took polyvagal and then I took the window of tolerance, and I kind of just created an idea of something based on what I was seeing with the population I worked with. And I believe that everybody has a window of tolerance of how much stress they can tolerate before their nervous system becomes dysregulated. And the reason the nervous system is so important to me is because you could take 100 people and put them on a line, and their window of tolerance is all going to be different based on factors in their life that could have made it short or smaller or bigger. And if they had parents who had a small window of tolerance, then you're more likely to have a small window of tolerance. And so I think it's just really important, is because kiddos, like from the moment even they're in the womb, they can be impacted by stressors. And if they're not discharging that stored stress from their body, I think of it like a cup. Like I actually have a cup of water right here. Like you're going to start to fill up your cup with stress arousal, and then it's going to overflow. And with kids, and I'm kind of blending kids and the incarcerated population, but I've noticed that a lot of people who are incarcerated have really bad agitation and anger, and they don't know why. They're like, I don't know why I just snap.
Yep.
And I'm like, you're outside your window of tolerance. Like you have moved out of ventral, where there's like that safety and connection, and you've moved into sympathetic, which is fight or flight. And your body is responding with action. It's saying, we're going to fight. And that's why you're showing up the way you are. And so that's just why I'm so passionate about it, is it's like, they think something's wrong with them. They're like, I'm in here for an aggravated assault or a battery or it's domestic. And I'm like, okay, while what you did is not okay, I want you to recognize the role your nervous system played in that. And while I'm not going to let you use it as a scapegoat, it gives you the ability to re-regulate your nervous system, discharge that stored stress, and to start rewiring or reshaping your nervous system to respond in a different way.
Which is why it's so important for all of us parenting and working with children that we use strategies and approaches and treatments that help expand that window of tolerance and give them tools for discharging that and regulating their nervous system when they're young. Whether you have a child right now who's been diagnosed with a neurodevelopmental or behavioral or mental health issue, or you just have a child who snaps easily, or you feel very challenged by maybe their agitation or how angry or anxious they get, this is why it's so fundamentally important to understand from a brain perspective what's going on there. Because I think what you're sharing about how, these adults say to you, like, well, I just figured something's wrong with me. Many of them have gotten multiple, various diagnoses, whatever, to understand why that this is actually a normal human response to being outside our window of tolerance, right? For any of us, if you give us enough stressors thrown at us for long enough, and we have only so much capacity to handle it, we're all going to react in unhealthy, inappropriate ways. For some people, that's that acting out in aggressive, hostile kinds of ways. It's a normal human response. And I think it's recognizing that some people, because of their history and trauma and everything that's happened to them, have a much smaller window of tolerance. And so we have to look at it through in another person's shoes, right? I can't look at what happens with a child, for example, where they snap at the slightest thing. If I look at it through my own perspective, and I've got a pretty big window of tolerance, that's not going to be helpful, because I'm assuming that they should be able to regulate that in a way they can. So we have to understand that people are operating with different amounts that they can tolerate.
Yeah. And I think the reason, I have a million reasons, but a reason I'm just so passionate about this and why I want to create the conversation so we can redirect our resources to kids is I have so many people who come to me and they tell me these horrific trauma stories from their childhood. They were sexually abused by grandpas, dads, brothers, babysitters. I've had people tell me, I had a guy tell me that he was chained to a fence when he was a kid and nothing but his, like, think of like a little boy in the little whitey underwear that little boys wear in the middle of winter. He was forced to pee in a cat litter box. I had one person tell me recently that as a 13-year-old, he was still wetting the bed. And one day his mom made him wear the wet underwear on his head out in front of everybody. And so I hear these stories and I'm like, okay, these were all little kids, all these little kids, what they went through, their nervous system became dysregulated. Their window of tolerance shrunk. Their amygdala created these emotional memories. And now they're navigating life, and all these cues in the environment that resemble those past emotional memories, they're igniting. And I want people, instead of looking at the kid of like, oh my gosh, this kid is a behavioral issue, what is going on? Just get curious and be like, what did this kid experience that led to the shrinkage of his window of how much toleration he can have for stress? And instead of being so quick to get them like an oppositional defiant disorder, RAD or whatever those diagnoses that they want to put on little kids who have some behavioral issues, just get curious, especially teachers, because a lot of these kids are home's not a safe space for them. And so when they're in school and they can't sit still and they're agitated, instead of getting frustrated with that kid, maybe schools can incorporate tools to help them feel a little bit more regulated. What can this kiddo do when he's in class and he's being triggered? Instead of being like, oh my gosh, this is such an angry little kid, be like, oh, he is in a sympathetic state right now. There's a stressor that is causing these behaviors. How can we help his amygdala feel safe so that it can move back into that ventral state of safety and connection? And I think the other thing is a lot of people get frustrated that their kid is having an angry outburst and the parent's trying to use words to calm the kid down. And if I can tell anybody anything, it's that when that kid is in that sympathetic state, there is no verbal language that is going to help them dysregulate to move back into ventral, because when they're in sympathetic, their amygdala has essentially shut off the cortex. So no cognitive thought can communicate with it. And it all becomes a survival response until that amygdala feels safe again.
Yeah. I want to touch on something that maybe some listeners are thinking about right now, because we're talking about, the population of children and adults that you have worked with that have what I think we would all consider very obvious, significant trauma. And by the way, I'll comment in my own experience of years of working in hospital and inpatient and all kinds of settings. I have yet in my 25-year career to meet a person who has, major issues with being in and out of the prison system, who's committed terrible crimes, or children who are exhibiting very, very inappropriate and even violent behavior, who do not have some significant form of trauma in their past history. I've yet to encounter it. If they exist, I've not met them. Tara, I don't know if you've met them, but that's how connected these things are. But I also want to touch on, because some of you maybe are thinking, well, I have a child who exhibits really aggressive or violent behavior, or, I have a child, maybe now as a young adult who is very, very challenged around regulating their behavior in various ways. And my child does not have a history of abuse, of sexual trauma, of, some of the things that, you're sharing the stories from your clients. Can we just talk about that for a minute, about how those are the obvious extreme cases, but trauma is a spectrum, right?
Yeah. No, and that's a lot of people. I always ask, like, have you experienced trauma? And a lot of them tell me no. And I'm like, okay, let me tell you what trauma looks like to me. And I always say that trauma is any stressor. I mean, it could be stubbing your toe. If you have a very small window of tolerance and you stub your toe, that could be a massive stressor for you. So trauma is any stressor that is too much for your nervous system to handle. It is when you feel powerless, helpless, or you're lacking control, your amygdala perceives you to be those three things, you can move into the zone of trauma. And so I think, as a kiddo, divorce can be traumatic. Bullying at school can be traumatic. Asking a girl on a date or a boy on a date and they say no, that can be traumatic. So it's just any stressor that's just too much for your nervous system to process. And I also just think it's really important to recognize of like, a lot of people don't think what's traumatic, but I think right now with COVID, kiddos not being in school, the fear of school shootings, there's just so many stressors that are going on. It's just individualized to that little kid, whether or not their nervous system can handle what's going on in that moment to keep them within their window of tolerance.
Such important points. And I would add to that, if you have a child with what we might call a neurodivergent brain, or a child who's been diagnosed with something like autism spectrum disorder or ADHD, or even learning disabilities, anxiety, those types of things, those kids are inherently going to have a smaller window of tolerance because their brain already struggles with processing just any input. Yeah. And so it's important to realize that, like, for example, some of the most intractably challenging kids that we work with at our clinic who really do struggle with significant behavioral challenges, safety issues, those kinds of things, school, their experience of school, their neurodivergent brain and the expectations of school have been so far outside their window of tolerance and their ability to process for so long that becomes a hugely traumatic thing and can lead to a lot of these issues. And that's just one example. Another example would be some of the kids that I see who have had a history of a lot of medical trauma. Mm-hmm. Maybe they've needed a lot of surgeries, a lot of procedures. Maybe they've had conditions that have been very mismanaged. And now, their window of tolerance in general for any kind of stress is so small because of the buildup of all of that. Mm-hmm. So I think, we just need to think in a more flexible way about how these kinds of inputs, experiences, genetic predispositions, processing problems can narrow that window of tolerance and then create, these nervous system issues.
Yeah. Yeah. I had two thoughts pop up when you said that. Is one, because I didn't even know this, but when you go in for surgery and you get put under, your nervous system, your amygdala essentially thinks that that's like the freeze state, and your body essentially moves into a freeze state. And that is still stress arousal in your body. And so a lot of people who come out of a surgery, it's really important to allow your body that rest and relaxation so you can discharge that stress arousal and move back into that ventral state. But then the other thing that I'm really passionate about, and I get really fired up with kiddos, is the foods they're consuming. School lunches, all the vending machines in school, kids who eat really sugary cereals. When your gut is inflamed or your gut microbiome is off, your vagus nerve communicates with your amygdala. And your amygdala, if your vagus or what's going on in your gut, it'll send a message up your vagus to your amygdala. It's like, hey, things are not okay down here. We need you to activate. And you move into that sympathetic state. And so you had made the comment about, well, my kid's never been through anything traumatic. Well, maybe get curious about what foods they're consuming or what beverages they're consuming or what's going on that could be causing that internal stressor, because that can also activate your sympathetic nervous system and move you into that fight flight response.
Mm-hmm. Perfect. And yes, I'm so on board with that. And for all of you interested in more, if you haven't already listened to all the past 200 and some episodes of the show, go back and do that now, because we cover all those topics on many episodes. Tara, the last thing I really want to get in, you and I could talk about this for hours, the stories that you have about the people you've worked with, just really profound and incredible, and stories that the world needs to hear. But I do know we're going to have to wrap it up at some point, but I want to touch on this because I really want the parents and professionals listening to hear your perspective on this, because as I mentioned earlier, there's this thought process that, well, if we just get these people mental health treatment, which consists primarily of some type of counseling or behavioral therapy and psychiatric medication, then we've done the job of dealing with their mental health issues. You and I both know how incredibly false that is. And you are seeing people in the prison system, and you saw kids in the inpatient system every single day who those things were in place for them at some point. Can you talk about why it is that this idea that medication is what needs to happen for these people to treat their behaviors, their mental health, why that's so misguided?
Oh man, I could literally talk like a whole hour just on this topic, but I think I used to believe in the medication model. I worked with individuals who were civilly committed, who were the most acute mental health. And I was like, I would tell them like, hey, like take your meds, like this is going to give you quality of life. And when I started to see like nothing's changing, they're coming back, or they're just so zombied or over medicated. And then I went and worked with somebody who wasn't at such a high level of acuity. And they were like, I started taking meds, and they give me this laundry list of meds, and they're like, nothing's helping, or it helped for a short period of time. I started to get curious, and I'm like, obviously this isn't working. And then I went back and I worked with the kiddos, and I'm just like, you guys are over medicating these kids. Or I would have a psychiatrist give a kid an injectable for an antipsychotic that's not even FDA approved for a kid. And I'm just like, what are we doing? And so while medication can help some people, for the most part, it doesn't help. It helps less people than people think. And I see people start to struggle with side effects, and then they get prescribed medication for their side effects. And then, just the whole rewiring it does in the brain, and the bodies become used to it, or people that get put on benzodiazepines, and then their amygdala essentially has to be stronger and stronger, because your amygdala is your survival response. It's what keeps you out of danger. When you are in danger, it gives you the ability to fight. And if you're constantly sedating it, it's trying to break free of a straitjacket, and people don't understand that. And so I'm trying to shorten this into a very short response, but I get a lot of pushback from people who think I am perpetuating the problem and I'm furthering the stigma. And I think at the end of the day, I have just seen so many people medicated who never had the root cause issue addressed, and they're still unhappy. They're still depressed. They're still anxious. They're struggling, or the disability rates are skyrocketing right now. And it's like, that's not a life worth living. That's not quality of life. Like, if you need medications temporarily, and I say temporarily, that's fine, but you need to do the work of healing too. Figure out what's igniting your symptoms. What can you do to change lifestyle factors, diet? And then when you feel like you're in a place, you can start to titrate off your medications. And so I think at the end of the day, it's just that. It's like, if medications were helping people, we wouldn't be seeing such a high disability rate. We wouldn't see so many people incarcerated. And I think kiddos would be able to best navigate their mental health when they're younger.
Yeah, it's so true. And even in the cases where medication is helpful in the short or the long term, it does not remove the fact that we still have to get in there and do this root level work around supporting nervous system development and expanding that window of tolerance, learning healthy behaviors, coping skills, lifestyle, developing those healthy relational attachments. Whether or not medication helps, those things all need to happen. And this idea that, well, the solution to these kinds of problems, especially these kinds of very serious issues in children and adults, is to make sure they're taking their prescriptions every day. Listen, I'd be the first in line to advocate for that if it actually worked. But I anecdotally in 25 years have seen that that does not work. And beyond just anecdotal experience, the data, the research on this shows this does not work. It can be helpful to reduce symptoms, to make them more tolerable, to help people do the work, but this alone is not the solution. And, I think actually the prison system is one of the most interesting places, or inpatient settings where we can see this in action, because here are populations of people who literally are being forced to take their medications every day. They do not have a choice. They are inpatient or they're incarcerated. They're taking them and they're not substantially changing. And that alone should be enough for us to say, okay, whatever your views on medication are, good, bad, or otherwise, clearly there is something else that needs to happen here to help these people.
Yeah. And I think it's important because for people incarcerated, they can give consent whether they want on meds or not. Luckily, like if they land on my caseload, they're not going to like it because I'm like, no, I'm not referring you right now.
Right. Yeah.
But there's people also who are harbored or civilly committed by the state, and those ones are force medicated. And that crushes my soul because it's like they don't even get a say.
Yep.
And that's like, you have to realize I didn't just one day flip the switch and was like, okay, I'm not a fan of meds, because I used to take Xanax. I was prescribed Lexapro and Wellbutrin. I drank the Kool-Aid. But when you see what I see, I'm like, what are we doing? You know what I mean? Like, and it's hard in the prison system too, because they don't have the environment that supports their mental health. The food, let's be real, it's not organic. It's not veggies and lean proteins. They aren't getting
organic. Most of it's not even real food, period, which by the way is not that much different than what our kids are consuming in the cafeteria, but that's for a different episode. Yeah.
But I think just like I started to read books and I started to hear stories, and I couldn't do it anymore. Like it made me sick. I'm like, I can't support this anymore. And while I still work in the prison system, I am a very loud voice of like, let's get to the trauma. Let's address what's going on. And I tell everybody that comes through RDU, which is where they all come from the county jails, I tell them your medications aren't designed for long-term. Some of them have been on them for so many years. I would never tell them to get off of them. But if they are not on meds and they're requesting meds because they're anxious or depressed, first I tell them like, you're having a normal response to coming to prison. If you are not anxious and depressed, I'm worried about you.
Yes.
And then I just educate them like, I don't know. I could go on forever, but at the end of the day, I just want people to know, like, I too drank the Kool-Aid. I saw that it wasn't working. I started to dive into the research and I'm like, oh my gosh, like I was kind of fed one narrative, and it's a narrative that doesn't actually support people's healing.
Yeah. I think, right, that idea that we need to be open to a variety of experiences with this. And for every one person who says, I took X, Y, or Z medication for this diagnosis and it helped me and, changed my life in a positive direction, there are many people who would say something different or the complete opposite of that. And none of those perspectives are right or wrong. It's recognizing that there are so many root causes and underpinnings to these symptoms that we put labels on and that we then medicate, that of course people are going to have a broad range of response and experience with that. And we need to be open to and understand that broad range of experiences, especially when we're looking at children and adults who are continuing to struggle. Yeah. And I so admire the work that you're doing. It takes a unique person and professional to be willing to swim upstream, especially in an environment like the prison system, teaching this stuff, supporting people in this way. It's a very unique thing. We need more people in the field who are willing to do it. And so I so appreciate that you're doing that work.
Yeah, I appreciate it. Like I said, I don't know why I went this direction, but the more I get into it, I'm like, I really feel like it's more of my calling and I'm just leaning into it. Like, it just feels right.
It's awesome. I want to make sure that people know where they can find out more about you and the work you're doing, because you also do this work, outside the prison system, and your podcast is great. So where can people find out more?
Yeah, I'm the most active over on Instagram at courageously.u, just the letter U. And then I also have a podcast. It's the Courageously You podcast. Those are pretty much the two places where I'm the most active.
Awesome. Tara, thank you so much again for the work that you're doing and for sharing it with us today. I know that this conversation and stories that you shared are helping parents and professionals who listen to this show just expand their own understanding of these things. And so we really appreciate you being here. Thank you.
Yes, thank you.
And thanks as always to all of you for being here and for listening. We'll catch you back here next time.